So as we've seen over the last few years, we're figuring out more and more mutations and alterations in lung cancer that are present in patients, in good percentages of patients that we currently don't have approved therapies for, but we have so many treatments that are in trials that are hopefully going to be effective in patients. And so I think a huge area that we are making strides in very quickly is in squamous cell carcinoma. As of now, we don't have an approved therapy, a targeted therapy in squamous cell carcinoma, and it was just recently that researchers have figured out some targets in squamous cell cancers, and now the drugs are emerging. And I think that there are some that look very exciting, and I really hope that they show effectiveness in patients with these targets, because right now we don't have the targeted therapies for those patients like we do for many patients with adenocarcinoma. I think another area that's really exciting and is very different than all of these other drugs we're talking about is the immune therapies. So the anti-PD-1 therapies and anti-PD-L1 and other immune therapies are something that work completely differently than these targeted therapies that we're talking about. And the target for these therapies, the immune therapies, is something that's still under investigation, but there are some really exciting early data on some of these agents, and I think we're going to see a lot more of that in the next few years, and it's something that I hope we have access to for our patients, both in trials and hopefully one day not on trials. And I'm really excited about that and hope and expect to see that more of that in the future. So I think one area that we're seeing is emerging as really important is FGFR alterations in squamous cell cancers, and also alterations of the PI3 kinase pathway. Those are two areas that are very commonly altered in squamous cell cancers, and there are drugs that we have that should be effective in those patients. Whether that will pan out is something that still remains to be seen. There's many trials that are ongoing, and when I have a patient who has squamous cell cancer, chemotherapy is my first treatment for them, but at the point where chemotherapy does not seem to be effective anymore, I will, as much as I can, try to put these patients on clinical trials, really trying to understand what the alterations are in their particular squamous cancer, and then trying to find trials that match up to that, because I think I hope we're going to see some benefits in the near future.